What's behind the racial gap in America's vaccination drive? Just a year after detecting its first case, the US has seen nearly 30 million coronavirus infections and more than 450,000 deaths. Now, vaccination programs are ramping up across the country, with Americans rolling up their sleeves for a shot at normality. But the journey has been anything but smooth.
COVID vaccine distribution mess.
Pfizer's vaccine rollout has hit a major snag.
Look, it's a logistical Rubik's Cube, let's face it.
The lines grew even longer today, winding through parking lots and side streets.
If we don't pick up the pace, vaccines could go bad before they even get off the freezer shelves.
One of the major difficulties facing the rollout has been its uneven distribution.
White Americans are getting COVID vaccines at significantly higher rates than Black Americans.
Black Americans expressing higher rates of concern about getting vaccinated.
Mistrust of the government and of the medical community may make some people reluctant to trust the safety of the vaccine.
According to the CDC, 60% of those who received their first dose are white and only 5% are black. And an NPR investigation found that vaccination sites are more common in white neighborhoods. This uneven distribution of the vaccine is alarming as African American communities continue to be the hardest hit by the pandemic.
Compounding the socio-demographics is the fact that African Americans have more exposures. Blacks are highly represented among hospital workers, delivery service industry, in public transportation. African Americans are more likely to live in housing environments that cannot support the social distancing policies.
The CDC says African Americans are dying at nearly 3 times the rate of white Americans and are being hospitalized at a rate 4 times higher. But a recent survey by the National Foundation for Infectious Diseases found that 31% of black adults say they will not get the vaccine and 20% say they are unsure. So why are many black Americans hesitant to get the vaccine? To understand this, we have to talk about one of the darkest chapters in American medical history. In 1932, a government study called the Tuskegee experiments saw health officials recruit hundreds of African American men with syphilis. They were told they were going to receive free health care, but actually they weren't going to be treated at all. Instead, doctors secretly tracked how the disease was progressing. And when an effective treatment option came out 15 years later, those black men didn't receive it, and many of them died or suffered severe health issues later in life. This study went on for 40 years, and it was conducted by the United States Public Health Service and the Centers for Disease Control and Prevention.
On behalf of the American people, what the United States government did was shameful, and I am sorry.
But it wasn't enough to regain the black community's full trust.
I'm still on the fence about the actual vaccine. In the African American community, we never really received anything that's going to be beneficial for us in the beginning.
The legacy of Tuskegee has left a deep scar on the minds of black Americans. So much so, there is a great mistrust for the US healthcare system as a whole. 7 in 10 African Americans believe they are treated unfairly based on race or ethnicity when seeking medical care. And 8 in 10 think doctors are not providing the same level of care to black people. One study by the National Academy of Medicine of 400 hospitals revealed that black patients with heart disease received older, cheaper, and more conservative treatments than their white counterparts. And after surgeries, black patients were often released earlier than white patients, and sometimes prematurely. So it seems America's healthcare sector needs to wage a two-front battle, helping the most vulnerable groups against the coronavirus while also treating historical wounds of mistrust.